Hello, my name is Karagach-Manta. I'm a third-year medical student here at the University of Ottawa, and today I'm here to discuss my poster, Targeted Therapies for Metabolic Myopathies Related to Glycogen Storage and Lipid Metabolism, a systematic review and steps towards a treatable. This project was conducted under the supervision of Dr. Hans Lockmuller. While individually rare genetic diseases collectively affect 1 in 17 people. For many of these diseases, there is no genetic-based cure. However, there is evidence to suggest that there are treatable cases with available pharmacological strategies. Nevertheless, many of these treatable patients remain either undiagnosed or do not receive treatment even after genetic diagnosis. Oftentimes, when they do receive treatment, there's a significant lag between the genetic diagnosis and its initiation. The growth of computer-aided diagnostic techniques has not been matched by the genetic-based support systems for treatment guidance. This has led to collaborative international efforts such as RD Connect to create a real-time transformation between evidence-based treatment recommendations into clinical practice, linking the genetic diagnosis of these rare diseases to treatment strategies that can prolong life expectancy, improve quality of life, and restore function to affected tissues. This approach, termed the treatable, begins with systematic reviews that critically appraise and summarize the scientific evidence at the level of the genetic variants to highlight treatable cases. So when a genetic diagnosis is made, treatment can be initiated. Previously, treatable projects have been done for congenital myasthenic syndrome and peripheral hereditary neuropathy. This review will focus on the pharmacological management strategies for metabolic myopathies related to glycogen storage and lipid metabolism disorders. So the metabolic myopathies studied in this systematic review were either ones where the genetic defect lied in the skeletal muscle, as seen in Figure 1A with Pompei's disease, or lied in other tissues but primarily affected skeletal muscle, as seen in Figure 1B with Corey disease. The lipid storage myopathies were inborn errors related to failure of mitochondrial beta oxidation or the carnitine shuttling of fatty acids into the mitochondria. The systematic review was conducted under the treatable project principles and included all forms of evidence that examined pharmacological interventions in patients who were genetically diagnosed with these aforementioned metabolic myopathies. The exclusion criteria was when there is either no confirmatory genetic diagnosis or the case did not involve pharmacological interventions. Our initial screen yielded over 1,000 results. After screening titles, abstracts, and full text, 87 articles were included in this qualitative treatable synthesis, many of which were dealt with Pompei's disease, multiple acetyl coenzyme A dehydrogenase deficiency, or carnitine transport deficiency. This systematic review will help enable the creation of this genetic-based decision support system by populating it with treatable variants for the aforementioned metabolic myopathies and highlighting the research available as well as appraising the level of research. For example, for L-glucosidase alpha for enzymatic replacement therapy for Pompe disease, this systematic review will contribute 45 studies, which including over 630 patients and 207 variants who responded to this therapy. As with many drug experiments, there are cohorts who do not respond to the therapy. Additionally, the systematic review will have examined these patients as well to potentially further add to clinical decision making when dealing with certain genetic variants that can improve outcomes with these pharmacological techniques. In conclusion, there's an increasing rapid translation between evidence-based therapeutic recommendations and clinical practice in the management of rare genetic diseases. The Treatable project summarizes genotypes from all metabolic myopathies related to glycogen storage and lipid storage and metabolism with tailored pharmacological management. The connection of sequencing data with the clinical phenotypes, such as described with the RD Connect project, can decrease the lag between genetic diagnosis and treatment initiation. By linking treatment evidence with the causative variants, this review can be used as the foundation for computer-based decision support system that alerts clinicians to the possible treatments at the time of genetic diagnosis, allowing to fully support them with the evidence needed to make an important clinical decision that can alter the course of a disease. Thank you for taking the time to listen to my poster. I'd like to also thank my contributing authors as well as the rest of the Hans Lockmuller lab. Thank you.